Hi, I'm Kaylin, and this is my clinical reflection presentation where I talk about the clinical objectives and how I met them. The first objective is to apply knowledge from previous courses in the physical and social sciences, humanities, and nursing in meeting the multidimensional needs of individuals and groups within the local geographic area. So I did that in three main ways. The first one was participating in the Nursing 320 skills sessions, where I used my previous knowledge of Foley catheter insertion and sterile technique to teach the current juniors how to also perform those skills appropriately. I also used a lot of therapeutic communication with residents at the Phoebe home and when participating in Camelot for children. The second objective was to apply basic principles of ethics, management, and leadership to meet the needs of patients and their families. So I did this when I collaborated with classmates for my ethical presentation, which was on hospice care, end of life, and right to die. So we are using that information to spread awareness at Research Day to other families and patients who may have chronic illnesses or be thinking about end-of-life care in general, and make them aware that those services are available to them, as well as power of attorneys and living wills, because a lot of patients you talk to, they don't really know about POAs and living wills, and those are very important documents should something happen to them, that they should know how to set those up, have them in place, and be able to use them if something occurs that they should need it. I also got to overhear discussions between the nurse supervisors at Lehigh Valley Hospital and the floor nurses in relation to handling an ethically difficult patient case. It had to do with a patient who was having a lot of mental health problems and just how to best approach the situation. And then the third objective is evaluating the effectiveness of communication in promoting the optimal health of patients and families. So I did see at particularly the Phoebe home and at Good Shepherd Rehab Facility how effective communication between the nurses and patients was so crucial in making sure that, therapeutically they were meeting all of their big steps, and working towards going home, and then also having a plan of care in place for when they do go home, because that's important too. They need to know their resources for where they can go, for home care, for medications, all of those things, and they need to know about their medications and their disease process, kind of what to expect and what isn't normal, when to call doctors, and all of that. And it's up to mainly the nurses to communicate that with them and tell them those sort of needs and what to do if, something arises that's out of the ordinary. I also practiced communication as a whole with my nurse leaders when I was emailing them back and forth about times to meet, places to be, what to bring, those sorts of things. And even though that's not directly related to patient care, it's good practice for communicating with patients as well, sort of covering all your bases and making sure that everything is clear in terms of what to expect and what to bring and what to do and what needs to be known, what isn't already known. The fourth objective is to critically analyze and integrate leadership research findings into the total plan of care for a selected group of patients and their families. So my ethical presentation was research on hospice and end-of-life care, which can also be integrated into a patient's plan of care, particularly if you have a patient that is diagnosed with a chronic illness and they're really expressing to you as the nurse that, hey, I don't think I want to go through with further invasive, painful, difficult treatment. You as the nurse are an advocate for that patient and their autonomy, which is a huge ANA Code of Ethics principle is to advocate for your patients and what they want, not so much what their families want or what doctors want or others want. It's all about that patient. So I gained that knowledge on how I would advocate for my patient and say, hey, you know what? If that's your wish, then I support you, and here's what we can do to get you on hospice care, and here's what would be involved in that, and what you should expect with that. My next objective was apply the principles of ethics, advocacy, and teaching to the everyday care of patients and their families. And I used this a lot in most of my clinical experiences. I used it whenever I was talking to patients, especially at Phoebe Home. I spent a lot of time just talking to the patients, which was very enjoyable. I had one patient expressing a lot of concerns to me about past facilities she had had very negative experiences at. So I talked to her about what should be the expectations at a facility and what should those facilities be doing, and how she as a patient should speak up for herself if she feels like her needs aren't being met at a certain place. I also ended up doing this with patients at the behavioral health unit during a peer leadership session, and I encouraged the other students to also speak with their patients and speak up with them about advocating for themselves and what they hope to get out of their time at behavioral health and what their end goals are, and so on and so forth, and what their families should also expect from their time there. Should they expect those patients to come back and they're 100% healthy and they're good to go and they're not going to face any more challenges, or should they be prepared to face some challenges moving forward with that patient's sort of mental health and such? The next topic was formulating plans for continued personal leadership growth and development as an independent practitioner of nursing. So in my course as a whole, we did a lot of researching. We did research for our discussions and for our research presentations. So I got to do a lot of that, and I found the best ways to research. So where to find the best sources and how to use my keywords for researching and find what was most relevant to the topic. And then I also got to see how continued research was utilized by my nurse leaders, especially when I was with my advanced practice nurse at St. Luke's. She worked in the education department there, and she was part of many different teams within St. Luke's, and one of her teams was the team of nurses, doctors, respiratory therapists that reviewed policies for the network as a whole. So I got to sit in on their meeting and see how they use the most current research and evidence-based practice and implement it with their personal network policies, and how they work together as a team to do that. It's not just one nurse or one executive, one doctor that decides those policies. It's a team of them that get together and say, hey, this is what would be most effective for my unit, or this is what would be most effective for this unit. There's differences between areas such as labor and delivery, or the ICU, or a med-surg floor. So it was good to see how they all come together to do that. And then my next objective was recognize the role of the nurse in policy making, related to healthcare services at local, state, national, and global levels. I accomplished this when I saw how nurses influence policymaking during our trip to Harrisburg. We sat in on a Pennsylvania State Nurses Association meeting where they discussed the cost of drugs, and we heard testimonials from nurses and patients in regards to how difficult it is for a lot of patients to afford needed or life-saving medications that can take up all of their salaries, and their insurance is not helping with it much, if at all. And those policy making nurses were working with other government leaders to brainstorm what they can do about it and look at other states, and work with some of these pharmaceutical companies to see if there's a way they can implement laws that would make it easier for patients to afford those medications. And we also talked about staffing ratios, because some of the staffing ratios are very high, out of control in some hospitals, and it's just not safe. Nurses can't work to the best of their ability when they have so many patients. So we had a really good discussion about how laws would impact hospitals and nursing as a whole. And then my last objective was predict and describe potential ethical dilemmas within clinical, organizational, and professional nursing practice. And I did this as well with my advanced practice nurse. We talked about sort of like travel nurses and how it's difficult sometimes with how quickly you bring them in, and make sure that they're following policies and they're doing what's best with patients, and how it can be difficult sometimes for them to handle ethical dilemmas when a facility may be very new to them and they don't know what steps to take. I also talked about this with my nurse supervisors when I was with them. They sort of talked to me about past cases they've worked with, or as mentioned earlier, the one particular case they had on a unit that was a difficult case. They weren't sure how to best handle that situation in a way that would work out best for the patient. And as well with the political leaders, nurses can very quickly be held responsible for any ethical dilemmas that come up, and not always have the most control over that situation. And should those nurses be held accountable, or should they not? Do we need to look at it case by case? It can be very hard because we don't want fear running nurses' lives and decisions. So those are my 8 objectives. When I was thinking about these objectives, my references were my textbook and the ANA Code of Ethics. Thank you for listening.